Today we're going to find out what the Herbal database can tell us about diverticulitis. Now this is the screen when you first open it up. There are two ways to look up diverticulitis. One is to use the search box, and there it is, you can click on it. But I'm going to show you the second way, just in case internet's a little slow, this is going to be faster. You click on the pins, go to menus, diseases and disorders, digestive system, gastrointestinal disorders, and we will scroll down to large intestine or colon disorders, and there it is. So let's click on it. So first of all, let's start with what it is. This is an illustration of the colon, and we see here diverticulum, and it's pointing to this, which is a view from inside the colon. On the outside, we see this little pouch called a diverticulum. It's not supposed to be there, but they can develop, especially as we age. And if it gets infected, we get diverticulitis. Diverticulosis is that little outpouching without inflammation, okay? Now, diverticulosis has no symptoms. Now, occasionally there can be a tiny bit of bleeding, but it's not really of a concern, and there's no treatment that's given for it. The problem comes when those get infected and develop into diverticulitis. So let's skip the videos. When you come in, I would suggest that you watch those, but let's get down to the nitty-gritty. So, diverticulosis, as I said, describes the presence of diverticula, or pockets in the wall of the large bowel. Acute diverticulitis is the clinical syndrome that occurs when a diverticulum becomes inflamed and perforates, which is relatively uncommon. People can also have recurrent diverticulitis, and that is considered an autoimmune disorder, but it's treated the same way as common diverticulitis. Complicated diverticulitis occurs when abscesses or fistulas develop and usually require surgery. If untreated, it can lead to spontaneous, non-traumatic gas gangrene. That's a hyperlink. If you want to learn about that, click on it. Diverticulitis is considered one of the manifestations of inflammatory bowel disease, by the way. So, what causes it, and what are the risk factors? Now, if we look towards vitalistic herbal medicine, energetic herbalism, it's classified as an example of the tissue state damp relaxation and considered a cold digestive disorder. And those often develop as a result of intestinal dysbiosis, imbalanced gut microflora, which encourages the overproduction of intestinal mucus and toxic microbial byproducts, creating microbial toxicosis. Now, if you want to click on Stimulate Digestion, Warm the Middle, Resolve Mucus Damp, that is one of the therapeutic approaches that you can take. Now, in terms of mucin, while not directly related to mucin production, diverticulitis can sometimes cause increased mucus production in the affected colon segment. And also, it's worth noting that when you have an infection from the bacterial species Enterococcus, that can bring on diverticulitis. Constipation is to be avoided. When you have those diverticula, you do not want to be forcing fecal material into those pouches. That's a big no-no. Besides increasing age, other risk factors include the use of NSAIDs like aspirin, Tylenol, steroids, opioids, smoking, and sedentary lifestyle. A low-fiber diet is considered another cause that's characterized by inadequate amounts of microbiota-accessible carbohydrates, and the consequence of a low-fiber diet can be altered healthy gut microbial composition and function because they eat that low fiber, and if you starve them out, the bad guys start to come in. That can increase the risk of diverticulitis. This dietary pattern can lead to changes in the gut microbiota, the gut epithelium, and immune cells, aggravating inflammatory diseases. So let's take a look at the role of NSAIDs. Those are the non-steroidal anti-inflammatory drugs. And corticosteroids. Medications like NSAIDs and corticosteroids are associated with an increased risk of developing diverticulitis and its complications, which include bleeding and bowel perforation. Regular use of non-steroidal anti-inflammatory drugs like ibuprofen and aspirin is significantly linked to a higher risk of diverticulitis. NSAIDs can impair colonic mucosal integrity and promote inflammation, raising the risk of both uncomplicated and complicated diverticulitis. It also increases the likelihood of diverticular bleeding and colon perforation. Moving on to corticosteroids, if you're using those, both the oral and the inhaled types, well, they also elevate the risk and its most severe complications, such as perforation and death. These drugs suppress immune responses and hinder wound healing in the colon, making infections and perforations harder to detect and increasing their severity. Studies demonstrate that a clear dose-response relationship with prolonged corticosteroid use amplifies these risks. In fact, there's a 71% increased risk with inhaled steroids. Corticosteroid users with diverticular perforation also experience doubled mortality rates compared to non-users. As far as the clinical considerations, well, obviously their use should be minimized or avoided whenever possible in those known with diverticular disease or a history of diverticulitis. There are alternative pain management and anti-inflammatory strategies, which is where herbal medicine excels. Patients on these medications and at risk for diverticulitis should be closely monitored for signs of diverticular complications. All right, now let's move on to prevention and treatment. First of all, in terms of treatment, acute diverticulitis usually requires hospitalization. When a patient recovers from diverticulitis, the inflammation and any associated infection typically resolve, allowing the symptoms to subside and normal bowel function to resume. However, the diverticula, those small pouches in the intestinal wall, don't go away on their own. Those are permanent structural changes. They're not resorbed back into the intestinal wall. The only way to remove them is surgery. What we want to do is focus on preventing future flares through diet, lifestyle changes, and sometimes medications. In terms of lifestyle modifications, these are suggested as preventive measures for diverticular disease. And of course, they're focused on dietary adjustments and weight management. Dietary fiber. A diet high in fiber and low in meat is recommended to balance the diet. Now, while fiber was previously thought to be highly beneficial, recent studies suggest its benefits aren't quite as significant as once believed, but we still need to get that soluble fiber in there to feed our healthy microbiome. Obesity reduction is important, and so is hydration. Maintaining adequate hydration is essential when increasing fiber intake. Now let's move on to non-pharmacological treatments. So there are several approaches that have been investigated, especially for preventing relapses. There's something called mesalazine, which can offer pain relief, but its effect on the outcome isn't very significant. We have, fortunately, a study that shows that lactobacillus is superior to mesalazine in the long-term remission of symptomatic uncomplicated diverticular disease. And that brings us to probiotics. The scientific research is focusing on the use of probiotics to prevent relapses. Bowel cleansing is a strategy that hasn't been widely mentioned in the literature, but it could potentially benefit patients who aren't suitable for surgery. Now then, herbal treatment. Herbs are going to be more suited to prevention of its recurrence, as well as incorporating aspects of treatment of uncomplicated diverticular disease described under diverticulosis. The approach to prevention of acute diverticulitis should additionally include immune-enhancing herbs like echinacea and andrographis to control pathogenic bacteria. By the way, before we go any further, I always recommend that as we go through these herbs, you look them up in the database and learn about them. Are there any contraindications? What is the dose? What are the cautions? Anyway, moving on, gastrointestinal antiseptic herbs, anti-inflammatory gastrointestinal herbs like meadowsweet and chamomile. Use of a soluble fiber with water. Start with small doses and increase over time. If you start taking high doses of fiber, even soluble fiber, and your gut isn't used to it, you can develop a lot of gas that's very uncomfortable. There are several herbal remedies that show potential in helping manage symptoms of diverticulitis. For example, turmeric. Now all of these are hyperlinked. You can click on them and go learn about them directly. This herb has potent anti-inflammatory properties that may help alleviate mucosal inflammation associated with diverticulitis, and it promotes healthy gut bacterial balance, and it also improves intestinal permeability. Boswellia serrata, which is frankincense. The extract has anti-inflammatory and antioxidant properties that can benefit the intestinal barrier. And there have been studies that showed it could help reduce pain intensity and even provide symptom relief in patients with symptomatic, uncomplicated diverticular disease. Berberine, which is found in plants like barberry and Oregon grape, has anti-inflammatory and antimicrobial properties. It can strengthen intestinal walls by increasing the production of butyrate. That's one of our really essential short-chain fatty acids, which improves tight junction expression. Also garlic, known for its antimicrobial and antiviral effects. Garlic can help prevent infection and improve digestion. That's something you don't want to take every day, maybe 3 or 4 times a week. Green tea, with its anti-inflammatory, antiviral, and antibacterial properties. Green tea can help reduce inflammation and lower the risk of infection. Ginger, traditionally used for various gastrointestinal ailments, it can help with symptoms like nausea and diarrhea. Quality chamomile. This herb has anti-inflammatory and antispasmodic properties that can help reduce abdominal pain and discomfort. And slippery elm, although I prefer using marshmallow to slippery elm just because slippery elm is at risk, but it is effective at soothing inflammation in the colon and promoting healing. Marshmallow will do the same. In traditional Japanese herbal medicine, Kampo medicine, there's a formula they've developed that treats acute diverticulitis. And here's a study on that. I've looked for it online to see if it's available. I have not found it anywhere, but perhaps it will come out on the market. Sporamin. This is a protein found in sweet potatoes, and it's been shown to have potential anti-cancer effects. According to one study, sporamin suppressed the growth of xenografted colorectal tumor nodules in mice by restoring the normal structure of the affected tissue. Now, this doesn't directly relate to diverticulitis, but it suggests that sporamin might have beneficial effects on colon health. While no specific foods are known to trigger diverticulous attacks, a diet high in fruits, vegetables, and whole grains is associated with decreased risk of diverticulitis. Sweet potatoes, which contain sporamin, are rich in fiber and could potentially be an important part of that diet. Probiotics and fiber-rich foods are often recommended for maintaining gut health and potentially helping to manage diverticulitis. Sweet potatoes are a good source of fiber and could contribute to this aspect of digestive health. There's another herb, cat's claw. It's recognized for its anti-inflammatory and immune-modulating effects. There's limited direct clinical evidence for its efficacy in this condition, and there are many other herbal remedies used, each with unique mechanisms and traditional rationale. This table compares cat claw with other herbal remedies. And we see that cat's claw has as its main actions being anti-inflammatory and immune modulating. As far as the clinical evidence, it's modest. There's preclinical and traditional use. And some notes about what it does: it suppresses nuclear factor kappa beta, it decreases cytokines, and it has low toxicity. In curcumin, we see it's potent in its anti-inflammatory and antioxidant activity. As far as the scientific evidence, it's moderate in clinical and preclinical studies. It reduces gut inflammation, strengthens the gut barrier, and it is widely studied. Then we have ginger, again anti-inflammatory and motility effects. There's good evidence for that one, clinical and preclinical, used for abdominal pain and nausea, and supportive for gut healing. Chamomile, anti-inflammatory and antispasmodic. Good evidence from traditional use and some clinical. It soothes the gut lining, relieves discomfort, and has antibacterial effects. Licorice root. It gives mucosal protection and is anti-inflammatory. There's moderate evidence in preclinical studies and traditional use. It strengthens the gut barrier, but it may raise blood pressure, and if you're concerned about that, you use the deglycerized version. Marshmallow is soothing and mucilage forming. There's limited studies, but it's traditionally been used. It coats and soothes irritated GI tissues. And psyllium husk. For fiber, it's anti-inflammatory. Here we see strong evidence supported by clinical trials. It bulks the stool, eases inflammation, and GI discomfort. If you're a subscriber to the database, you can come in and read some of the key comparative points here. I'm going to skip this part. And there are some of the studies that back it all up. And then down here where there are quite a few more articles and studies divided up into what the risk factors are, prevention and treatment. And in closing, I want to point out that there are a couple of links at the top for an herbal product that's available that has some good evidence for treating diverticulitis. And when you click on that, you'll find those. In closing, just a reminder that it is important to follow your doctor's instructions if you have acute diverticulitis, and that may include a low fiber or no fiber diet during the episode, and also a prescription for antibiotics. This can be very serious, so do what the doctor says, but now you have this resource to use. Some of it you can use alongside the drugs, some of the anti-inflammatory herbs, for example, and definitely once you get over the acute phase to prevent it from recurring. Now, if you are not yet a subscriber to the Herbal database, it's very inexpensive. Just go to herbaldatabase.org. It's only $15 a month, and you also can opt for $100 a year, or even just 1 month for $15. So I hope to see all of you as subscribers. I have some exciting announcements coming up for database subscribers, so stay tuned for that.